Hello, everyone. Thank you so much for joining us this morning, taking time out of your morning to talk all about Medico's new dental product. My name is Sadie Frazier. I'm a training and education specialist here. And today we are joined by Medico, our partners over Medico. We have Augusta Ratliff. She is the Regional Sales Distribution Manager. She is the expert on this dental product. But before I pass off the reins to her, I just have a few housekeeping items that I will go through really quickly here. As always, we have that questionnaire box. Please feel free to use it. If the question's not quite as relevant to what we're talking about right then and there, if you can, save it for the end. We will have a Q&A portion, but if you need to ask it, have an answer right then because it's relevant, please go ahead and use it. We'll try to get to it as quickly as possible. Also, if you want to remain anonymous, that's totally fine. Go ahead and let us know. But we will address you by your first name because we're all friends here. We're all partners here. So let us know if you don't want to have your name mentioned there. Also, be looking for a follow-up email here. Today will be recorded, but if you have to jet off or whatever, that's totally fine. We'll have that recording there, but stick around if you can because we have lots of good stuff and it's always nice to hear those questions live and have that interaction here. Let's see, I think that's all the housekeeping I actually have. So, Augusta, I'm going to go ahead and hand it off to you.
All right. Well, thank you very much. And thank you, everybody, for being here on this wonderful Thursday. Hopefully, we learned a little bit of something today about our new dental plan that launched this morning. And as far as I know, we've already got some products coming in. So I'm very excited. And if you are familiar with Medico and you've opened your My Enroller today, you have seen some changes or been asked to resync it for some changes, and we're going to go over those a little bit later on in this. But for now, we're going to jump in here. We're going to talk a little bit about marketplace and cross-selling opportunities as well today. And like Sadie already said, if you have questions, please make sure you ask them. You don't have to necessarily wait till the end to go ahead and type them in over there, but we might wait to answer them until the end. So if you have them as we go, ask your questions. I'll send these slides and what we're calling a toolkit over for a follow-up email today. So everything you see today and we talk about today, you will get by the end of this webinar or this afternoon. So don't worry about that part. So as we jump in here, maybe some of you aren't as familiar with Medico, and that's okay, but let's look for some reasons of why you should be choosing Medico. And actually, my first bullet point, as I learned yesterday, is not correct anymore. We are now a A-rated, not an A- rated company, and that still means excellent from AM Best, but that's very exciting to go ahead and move up a little bit from the A- to an A rating. That just means that we're a financially strong and stable company. We're really just moving forward. We're looking forward. We're beginning to be more proactive in our approach of doing business. And this product is one of those ways that we really show that. And what we're doing throughout the year of 2021. Some of you may know, you may have heard already, maybe you haven't, but we're also releasing a new Med Sup this year. So lots of new exciting things coming from Medico. To show that we are trying to be more proactive in the marketplace. We also have those innovative tools for business development, like the My Enroller, which has been updated to be even better than it already was. We also have multiple products, so we have a full portfolio of products. We have the dental product that we're going to talk about today, Med Sup. We have a first diagnosis cancer product, and we also have a hospital indemnity product, which most of you are probably more familiar with since it is that industry leading product. We are going to be doing some revamps to it over the next couple of years as well. So we're really kind of just moving forward in the world. One of the things that Medico can offer you that a lot of companies cannot, so, is that accessible, expedient underwriters, and that also pertains to claims. You guys actually have access to both of them. If you ever need anything, you need a second look on an application, you need help with an application, you can call in, you can talk to them. If we're having any claims problems, we can always get a hold of them. Usually when I tell agents to call in for claims, I always ask to be involved in that one just so I can follow up. Usually that's not a one-time answer thing. As you guys know, claims can take some time. So I always like to be involved in that one too. Underwriters, though, they're yours to talk to and get your questions answered. You have sales team, which I'm part of. You also have agent services, and then your clients have access to customer services. There's a lot of people here that are just, we're here to help. We're your team to get your business written and get it in place. So ultimately, we just want to make doing business with us easy. So why does dental coverage matter? What is the whole point of coming out with a new product and really pushing this product and hoping that we see the benefit in these kinds of products? There's a lot that goes into dental health, and starting with oral health, there can be good oral health, there can also be poor oral health, and that can lead to a lot of things: respiratory disease, cardiovascular disease, diabetes, osteoporosis, Alzheimer's disease. There's a lot of other things that go into oral health, and some of those kind of shocked me at first when we started looking at this. I didn't realize that, and the more you think about that is, hey, if I don't realize that, probably your average Joe who isn't in the insurance world probably doesn't realize it either. Maybe they're not in the health world, anything like that. They're probably not going to realize that. So bringing up points like this can help kind of get your point across of how important a supplemental coverage is here. Now, your first chance to cross-sell. According to American Cancer Society, 62 is the average age for most people diagnosed with mouth, throat, tongue cancer. When you start talking about any type of cancer at all, you also talk about a first diagnosis cancer product. If this were to happen, they now have a dental product and a cancer product that are going to come together and make sure that they are fully covered and they're not taking money out of their own pocket, out of savings. With as low as the premiums are, this is completely doable and to still save money in this instance. Now, most people that you talk to, they're going to say, well, I have a Medicare. I have a Medicare Advantage. I have a MedSup. I have this. I have that. And that's where you kind of come in and say, okay, but there are some limitations. There's some misconceptions here. And what I always consider is that the Medicare beneficiaries are your opportunity group. They're your opportunity to cross-sell basically anything with. That's where you start when you want to cross-sell. That's who you always go back to in your first meetings. Are they going to be those Medicare clients that you have? And there's 52.6 million in the United States. Now, that's in total. That's probably not just your book of business. How awesome would that be, though, just to have a little tiny bit of that book of business? But your opportunity here, let's say that you have, 50 of them. That's a really good starting point to come back and say, okay, do you know that Medicare does not cover routine dental services and cleanings, fillings, tooth extractions, or dentures? Most likely they're going to say, I did not know that. So what do they do then? You start looking at a standalone product, which is what Medico has. That's what this is going to be. This is what that's already in place is a standalone. And that's where it comes into play and can help them cover those co-pays, cover those out-of-pockets, cover those things that's not going to be with the Medicare. What we're finding is that nearly 40% of seniors have not had a dentist visit in the past year because they don't know that standalone exists. So that's leading to your next cross-sell opportunity, a dental ER visit every 15 seconds, because we know that Medicare Part A can only help pay for inpatient hospital care, dental emergencies, complicated dental procedures, things like that. But if they're going to go into a hospital, we want to be able to help them in multiple ways. So a dental product and a hospital indemnity product. We know that most Medicare doesn't kick in until the 5th day that they're there. We can get their coverage started on day 1 with a hospital indemnity plan. So as you can see, there's a lot of opportunities to go ahead and talk about those cross-sell products and helping them say, hey, it's just going to cover your co-pays. It's going to help cover any gaps in coverage with the Medicare product, and it's still going to be saving them money. The premium is going to be lower than what they would be spending on a hospital bill. Now, what's the other reason that people are not going to the dentist besides the fact that they don't know a standalone product exists and they don't know what their Medicare does not cover? They're seeing these average costs of dental services. Now, this is U.S. average. This is not just Omaha where I am, But you can see that an x-ray is around $65, all the way up to dentures around $1,400. So let's say, I mean, I'll take myself for instance. I went to the dentist this year for like the first time in probably like 3 years, just because, you know, life happens and you forget to do things and you don't really think about it until your tooth is hurting and you're like, I don't know why that's happening. Well, no one's looked at it in 3 years. So then you need the cleanings, you need periodontal scaling, and if we're in the senior crowd, they might need dentures by that point. So most likely they're not just looking at one of these costs, they're probably looking at multiple. And that's going to add up to something people just don't have out of pocket. If we're in that senior market, we're probably talking about somebody on Social Security or their retirement. They have a limited income. They have to think about where they're going to spend that just a little bit more than maybe somebody who's still in the working force. So now we get the opportunity to introduce a new dental insurance to them. There are 2 plans, and these 2 plans are available in 11 states as of today. But we are going to continue to roll out in tiers. So tier 2 and 3 is what's going to continue to roll out throughout the year. Tier 2, we foresee probably towards like the middle end of summer, definitely before AEP season. 3 might just be a little bit later in the year. Everything that you see in the gold is going to be the new gold and platinum product plans. And the blue is what we currently have with the DVH plans. So if you're in Missouri right now, which I know some of you probably are, Missouri is tier 2. So it'll be just a little bit later, but it is giving a new product, and you guys will be notified. We'll push it just as much as we've been pushing this new one. It's not going to be, we're not going to roll out like one state here and one state here. We're going to do kind of clumps of states like we are right now with the 11, and then we'll continue to do that. Gray states, they're not going to have anything. We're actually adding 7 states to our dental portfolio. So we're going from 33 to 40 states in total, which is also very exciting to us and hopefully to you guys. That gives you just a little bit more opportunity group. Now, where is our network? We do still have a network. We have the Freedom of Choice is what we call it. It's the Maximum Care Plus Connection Dental Network, one of the largest networks nationally, focuses on neighborhood dentists. Your clients, though, they can use any provider and receive coverage. They're just going to get additional savings if they use it in-network dental provider. You can help them find that out there on that client-facing website. That's www.gomedico.com. There's a portion called Dental Network, and you can help them find it on there. So let's see what this plan has to offer. There's the 2 plans with 4 calendar year maximums, and we'll look at it like a table here in just a second to illustrate all of those. Your clients are going to have 2 options for discounts. They're going to have a spousal option. So let's take like a husband and wife, and one of them gets the product and then the other one decides to get the product. They'll get a 12% discount on the spouse's policy. So we're thinking about the fact that usually if they're married or getting married, they've lived together for a really long time, they're probably coming out of the same account. So they're still like, it's like they're both getting the discount, but it's a 12% discount. And then they have the opportunity for a multi-product discount. This is if they already have issued or they're applying for a Medicare supplement or final expense, they get a 5% discount. We're also going to offer first day coverage. So as most of you know, if you're familiar with our current plan, we don't offer first day coverage, especially on preventative services or major services, but we're going to offer that now. And now they have 2 options for riders. There's a buy-up rider. So let's say that your client purchases a Gold 1000 plan, and during the application, they decide to buy up another $1,000. They now have $2,000 available to them. And then they have the calendar year maximum carryover benefit. So first thing that you can see here is that we're not going to be on a policy year anymore. We're going to be on a calendar year. So at December 31st, that's when this ends. With this one, we say that let's say that your client go ahead and purchase the calendar year maximum rider. Let's say they do it during AEP, so maybe in November, and they purchase that Gold 1000. Most likely they're not going to use any of that $1,000 by then, unless it's something they're like, I need it done right now. December 31st hits, they're going to carry over that $1,000 into the next year. Now they have $2,000. It will max out at $3,000, but they do have that opportunity to get just a little bit more over the year. If they use 500 of it and they have another 500 left, that 500 carries over then. The biggest thing on here, applications are only accepted electronically. That is all dental products right now. So the DVH plan, which would technically be our old plan, and this new plan are going to be accepted electronically. Issue ages are still 18 to 89, guaranteed underwriting. So taking just a little bit closer look here, the biggest difference that you're going to see is in that basic services. Under the Platinum plan, Medico is going to pay 80% co-insurance on basic services after the $50 deductible. $50 is different than the $100 that we currently have. And then we're going to pay 50% on the Gold plan. That's your biggest difference here. That's really your only difference. So the $50 deductible, $0 for preventative services. So preventative, that means that it's first day and first dollar coverage. Routine checkups are now covered at 100% with no deductible. That's different than the current one. And just so you know, we're going to take just a quick look at the current plan after this. So all the comparing, you'll be able to see that again and just kind of have a reminder. Basic services, we just talked about the 80 and 50, and then major services. There is a huge difference between the old plan major services and the new plan major services. There is first day coverage on major services now, but the first 12 months after the $50 deductible, your client will pay 80% co-insurance. So Medico will pay 20%. In the second year, the second 12 months, it'll be a 50-50 split. Also new with this is that crowns are covered every 3 years and implants are covered every 3 years with no inside limits. What that means is 1 crown for 3 years, 1 implant for 3 years. That is different than currently because it's 1 per 7 years. Okay, so there's our new plan, very exciting. But let's just have a quick recap of what the DVH plan looks like. It has a $100 deductible. Again, applications are accepted on electronically only. And then you have your varying coverages. Issue ages, 18 to 89. So I'm going to bring up all my bullet points here. We have our standalone dental, which includes no vision or hearing coverage. You can see that there's a 3-month waiting period for preventative services, 6 months for basic, 12 months for major. So you just got to see how all of those change. DVH plans, you can see the coverage is going to build over years 1, 2, and 3 from 60, 70 to 80%. 3-month waiting period on preventative, no waiting period for basic, and then no waiting period on the eye exams. That one, they had the 2 policy or maximum options. And then you have your Dental Plus, which is going to include dentures and implants. It's going to include implants, sorry. All of the major services include dentures. Okay, so there's just a quick look of what we have in place right now. But let's talk about My Enroller, because if you're not familiar with it, you're definitely going to need to be. My Enroller can work anywhere because you can use it with or without internet connection once it's downloaded. And you can also do quoting and app processing on here. So if you wanted to do a quote and then send it to them via PDF, you can go ahead and do that, or you can print it off and give them a PDF version of their quote, and then you can come back in and finish the application if you want to. This can be used on desktop, laptops, tablets, and I'm going to show you guys how to download it really quick, because if you are using the online version, you can now go back in and use that. We do have a new version out, and I'm encouraging you guys to go ahead and re-download the online version now. We also have multiple signature options when it comes to e-signatures. You can do in person or not in person. If they're not in person, you can email it to them. They just need their birth date and their phone number, and then you can do the voice authorization. Voice authorization is like over the phone. You just have to use like your cell phone or an office phone, something that can conference call you in. We're going to give you a prompt to read. It tells you everything to say because it is recorded. And we need your clients to give a yes or no answer, and then it will be attached to their file as their signature. If you need to download it, you're going to go out to MIC, the mic.gomedico.com, and you're going to come over here to the right-hand corner and go to My Enroller. Now, if you've never been out to MIC, you will have to register, and you do need your agent number for that. If you need help finding that, you just need to get a hold of me or agent services. It'll take us about 2 seconds to get that for you. So click on My Enroller, and this is what your page looks like. You have your offline version, your iPad, and your online version now. These do look new. So if you are familiar with MIC or with My Enroller, these do look new to you. when you open it, this is your home screen right here. And then you come in here and you're going to click your products. When you click Med Sup, it's going to bring up this little pop-up for you to remind you that if you cross-sell with the dental, they get a 5% discount. As you're going through it and you get to the end, when you're just about done and your payment method, it's going to bring it up again. If you have not selected the dental, just to remind you, hey, don't forget, they get 5% discount if you get a dental product. And then at the end, you get one more option here. It tells you if you click to quote, you can add a dental plan, or you can just complete your case. So selling this plan, what is our marketing material going to look like? We have new marketing material out there for you. You're going to have two kinds of highlight sheets. You now have English and Spanish. I'm not sure how big your Spanish market is, but that is now an opportunity for you with the dental highlight sheet. You have just a little bit more ways to communicate or ways to show them this. So the one I do want to show you, though, is we now have a new brochure, and it is a pretty awesome brochure. So I'm going to bring it up on the screen for you to take a look at, because there is one piece I want you to see that we are putting in here that is completely different than we ever have done. Let me bring this over. Let me make sure you guys can see the brochure. Yep. Okay, so this is what your brochure is going to look like. This is the PDF version, obviously. This is what you'll get today, but you can also order hard copies on that MIC website. And on about the third page, come on, you'll see here cost per month. So we are now going to put out the cost per month in the brochure. And this is telling you if somebody, doesn't matter who they are, applies for a gold 1000, it's going to be $36.80. They apply for a gold 1500, they're looking at $46. This is something different that Medico has never done. As you know, we usually are rate structured on male, female, ages, zip code, all of that. Not anymore. This is what we're telling you. And now for writers, and this is only for dental. Let me make myself clear on that one. This is for dental that we're changing that, not the other products. We can tell you about our writers. So the buy-up writer is about $12 per month. The calendar year carryover is about $8 per month. So I do encourage you to use your brochure because it is there to help you, and that is a very helpful thing that it's going to do for you, that you might not actually have to bring up MindRoller to give a quote for your client. All right, so there's the product. Now, when we talk about a new product, we have to talk about incentives. This incentive starts today, April 1st, and runs through June 30th. It is dental, and I will have this flyer in our follow-up package as well. There is no minimum number of applications required, and each app is $20. So if you write one app, it's $20. If you write two, it's $40. If you write 16, that's my little example over here, it's $320. All right, guys. Thank you so much for being on here. If you do have any questions, you can always contact me. I'll send out my information, but this is also Agent Services phone number. If you need to get a hold of them before I get a hold of you, you can always call. And then don't forget about your MIC website. Go do your changes, do your updates for MindRoller if you have not already today. All righty, I believe I'm handing it back over to see if we have any questions.
Awesome. Okay. Hey, thank you so much, Augusta. You covered a whole lot there. So now, like she said, we're going to roll into our Q&A portion, and it looks like we have a couple questions here. So, okay. I know there are tiers, but do you have a timeline of when the tiers will roll out, specifically Mo? So specifically Missouri.
I don't. I've actually asked that one about 3 times because Missouri is my state, and I'm very curious to get it done. I know that we've been filed there. I believe it's been approved, so I think it's kind of any time. I'm hoping by end of summer. That's what I keep getting told, that here in the next few months, Whenever I do get told, though, I will be sending out a mass email to everybody in Missouri, so you guys will know as soon as I know.
Perfect. Alrighty. Let's see. Was the maximum payable for all services $1,500?
Yes. Yep. So there's a gold 1,500 and there's a platinum 1,500. But they could also do the buy-up rider of another $1,000 at the time of application if they wanted to.
Perfect. Let's see. Are benefits paid based on usual and customary or based on the actual cost of the bill?
This is somebody else asked me that question yesterday. I believe, and it's one that's being double checked, that is on the cost of the bill. That's how we do like hospital indemnity. It's whatever's billed out. So we always, we've been told that this is the same, it works the same as the hospital indemnity, so it's on the cost of the bill.
Perfect. Let me scroll here. Okay, does the enrolling system work with Chrome?
Yes, it does. Yep. And it will now work with Chromebooks also. So that is something else that's new.
Awesome. Good, 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 good. Okay, if you guys have any questions, keep rolling them in. I have a question of my own. I just like to ask this question since you all are the presenters, are always the experts. I guess, is there anything about this new Gold and Platinum plan that you are really excited about? What are you most excited about?
I am most excited about two things. The no waiting period on major services. That's a very big thing to be able to offer somebody, especially senior market, because sometimes you're looking at just a little bit more in extensive work to be done. That's a very big thing to offer. And then the calendar year carryover benefit, I think, is going to be huge for us and for your clients, because they don't want to get to the end of the year and then lose something that they haven't used but they paid for. Now they can carry it over and continue to use what they're paying for and kind of get more for their money, more bang for their buck, really, by being able to keep that. And that is a rider that, as far as we know, nobody else offers.
Yeah, absolutely. That is a very unique, very cool, eye-catching feature for sure. So awesome. And it looks like we have another question here. Can the entire amount of the benefits be used for vision benefits, or are there limits?
So you're talking about our older plan is what I'm going to call it. And I believe they can use it however they would like to use it. I'm going to take just a quick look on my other screen here.
Sure.
But as far as I know, it's theirs to use however they want. So that it's just the coverage is the only thing different. Yeah, it's theirs to use.
Awesome. Okay, it looks like we don't have any other questions. So everyone be looking forward to a follow-up email. I guess I said she has some resources, some slides to send over to us, so you'll have those as well. If you have any questions, please feel free to contact Senior Marketing Specialist. We can definitely try to answer all the questions that you have for this. And yeah, thank you so much. Thank you, Augusta. Thank you for taking time out of your day to do this presentation. This is wonderful. We're excited about this. And thank you, everyone, for taking time out of your day to spend and educate and learn and try to grow your portfolio. So yeah, thank you so much. We'll let you guys get back to your day.
Thank you.